Vitamin D. But not the way you think, not the 600 IU the government recommends. Most physicians who supplement privately are taking between 2,000 and 5,000 IU daily. Some go higher under blood level monitoring. Why? Because deficiency is almost invisible. You won't feel it for years. But when researchers look at immune function, cardiovascular markers, mood regulation, even cancer risk, low D shows up in the data, quietly, consistently, everywhere. The recommendation you received was designed to prevent rickets. The dose doctors take for themselves is designed for something else entirely. That gap, that's not an accident. That's how medical institutions work. Minimum thresholds become official advice, and official advice stays conservative because anything more requires a level of individual judgment that mass healthcare cannot afford to give. But you're not mass healthcare. You're one person, and so is your doctor. Now here's where it gets strange. Magnesium, specifically magnesium glycinate, not the oxide version you find cheapest on supermarket shelves. That's the one that barely absorbs and sends half the population to the bathroom. Glycinate, or threonate for brain-specific benefit. Doctors who focus on sleep, recovery, stress biology, they have strong opinions on the form, and the form most of them choose is almost never what's in your current cabinet. Why does this matter? Because magnesium is involved in over 300 enzymatic reactions in the human body. It's not a supplement for one thing, it's infrastructure. And the majority of adults, eating what we eat, stressed how we're stressed, are running on a quiet deficit they've normalized as just feeling tired. But they've named that feeling aging, or being busy, or I just need a vacation. What they needed was a mineral. Stop, because this next part changes everything. Omega-3 fatty acids. You've heard of fish oil, probably dismissed it as basic. Here's what the basic version leaves out. Dose matters. Form matters. The research that cardiologists reference, the REDUCE-IT trial, the STRENGTH trial, they're not testing the one-a-day fish oil gummy your mom recommended. They're using pharmaceutical-grade EPA concentrate at 4 grams daily in specific patient populations. That doesn't mean you need a prescription dose, but it does mean the 300 milligram capsule you bought on impulse at the checkout counter is, biologically speaking, almost nothing. Doctors taking omega-3s personally are looking at total EPA and DHA on the label. They're checking the triglyceride form versus ethyl ester. They're thinking about oxidation, whether the product they hold smells rancid before they even open it. You weren't taught to think about any of that. That gap between what doctors know and what gets passed to patients isn't always malicious. Sometimes it's structural. Healthcare appointments average 15 minutes. There's no time for nuance, so nuance disappears, and you walk out with the same generic handout you've been getting for a decade. Now, here's the one that surprises people most. Creatine. Not just athletes, not just people chasing physique goals. Physicians in their 50s, 60s, neurologists, geriatric specialists, quietly adding creatine monohydrate to their morning stack. Because the conversation around creatine shifted. It moved from gym culture into longevity biology when the muscle-brain connection became impossible to ignore. Creatine phosphate in neurons, cognitive protection under stress, muscle preservation as we age, and the evidence that muscle mass is one of the strongest predictors of long-term survival and independence. When geriatricians started saying that, when they started connecting muscle loss to mortality risk with the same urgency they once reserved for cholesterol, something changed. Creatine stopped being a supplement for aesthetics. It became, for some physicians, a supplement for the long game. 5 grams daily, monohydrate, cheap, studied for decades, and almost never mentioned in your checkup. Ask yourself why. We're not done. The most unexpected item on the list isn't exotic. It's not a root from a rainforest or a peptide that costs $400 a month. It's something your grandmother might have recommended. Fiber. Specifically, fiber supplement for people who know, not guess, but know, they're not hitting 25 to 38 grams daily. Gastroenterologists who have spent careers looking at the inside of human colons come out of that experience with almost a spiritual appreciation for the gut microbiome. They supplement with psyllium husk, with inulin, not because it's fashionable, because they've seen what fiber deficiency does over time, and they've decided not to experience it personally. The gut isn't just digestion. The gut is immune function. The gut is the enteric nervous system, what some researchers now call the second brain. When a doctor who studies gut health decides to take fiber every day without fail, that's not coincidence. That's someone who saw something that changed them. Here's the part that should make you pause. Everything in this video is publicly available information. Medical surveys, physician forums, published interviews. No secret was required to compile this. And yet, most people watching this have never heard this specific information assembled in this specific way.